I'm Dr. Taylor Gregory, the VP of Animal Health here at the Greensboro Science Center, and recently we anesthetized one of our Trumpeter Hornbills, Ronnie, for an annual exam. For her annual exam, Ronnie is brought to the hospital by her keeper. From there, as vet staff, we get her under anesthesia by placing her in a mask where we give her inhalant anesthetic. Now, since Ronnie has a very unique beak, we have to be a little creative in how we get her in the mask. We don't have a mask that's designed for Ronnie, so we have to make one on our own. The one that fits her face nice and snug, and we're able to get her full face in there so she can breathe in that anesthetic in order for her to go to sleep quickly and calmly. Just like in mammals, we do try to intubate our birds or put a tube in their trachea to protect that airway space. In our birds, it is a little easier in that you can see their trachea because it's much more forward than it is in our mammals. Once Ronnie's appropriately anesthetized and we've gotten around to vital parameters, making sure her heart's beating strongly and that she is breathing appropriately, we'll go forward with a physical exam, looking at her eyes, palpating her, making sure all of her joints are moving smoothly. Now, as an educational institution as well as a facility for people to visit, the veterinary team here hosts a variety of people to come and learn. This includes veterinary externs, like our extern that we had here, who are fourth-year veterinary students coming to learn about zoo medicine, as well as college students sometimes that come to shadow and just get exposed to zoological medicine. After her physical exam, we went ahead and got blood on Ronnie. Now, with Ronnie being a smaller animal, we weren't able to get as much blood as we had wanted, and in order to compensate for that and still try to get as many values as we could, we made a blood smear, which is essentially a smear of blood on a slide that we can send out to the lab, and they can look at that versus running blood through a machine that we can still then get as many values as possible without sending a larger amount of blood. And the final part of Ronnie's exam are radiographs. That gives us a view into Ronnie's bones, into her organs, and everything internally that we can assess to make sure that it's normal. And if it's not normal, then we can use that knowledge to manage her care moving forward. When we're done with Ronnie's annual exam, it's time to go ahead and wake her up. So we turn off that inhalant gas and give her only oxygen. When she starts showing signs of recovery, then we'll go ahead and pull out that tube that's protecting her trachea. And once she's showing enough signs of being awake, we'll go ahead and let her be back in her crate. We may still be monitoring her, may still have hands on her depending on where she is in her wake-up process. But once we're comfortable, we'll be hands off and let her continue recovery on her own. As for her exam, Ronnie for the most part looks very healthy. She did have a few abnormalities on her radiographs that we are comparing to radiographs of other trumpeters from other institutions to look at whether or not they are something of importance, and we'll continue to monitor her for clinical signs. And once we get all that information back, then we'll adjust her care as necessary. But for right now, we're continuing with normal care because she's showing no signs of any concern. Overall, trumpeters are a really cool bird species to work with, and it's really great having the two of them here.